Men have delivery pains too. Introduction. The arrival of a baby is a wonderful time. When a new baby comes into the world, it's a miracle. During the delivery, the focus is on the woman. After all, she's the one feeling the pain, right? But what about the father? Often he's uncertain of his role. Men in the delivery room have their own issues, and they'll be addressed in this book. First, though, remember back to the time when men weren't allowed in the delivery room? Guys were relegated to the waiting room, left to pace the floor as they waited for their children to be born. Thankfully, there's been a shift in tradition. Now, over 90% of dads are right there with their partner, encouraging her on. Today, men's only role isn't just during conception. They share the entire experience of pregnancy, joining in on the excitement, choosing nursery furniture, picking out names, and taking Lamaze and parenting classes. Even with this involvement, when it comes time for the nitty-gritty business of getting that baby out, it can still be overwhelming. If you feel out of place and nervous during the birth, imagine all the men who are all welcome to see the birth that aren't the father. With the advent of birthing rooms, the door is now wide open for all sorts of men to see this miracle. It's common for uncles, grandfathers, brothers, and male friends to be invited in. So if you're the male, you'd best be reading on. You'll never know exactly what it feels like to carry and birth a baby, but you can learn as much as possible about it. Let's not kid ourselves, though. Even with this knowledge, you'll probably still feel anxious about being there. But knowledge is power, and with it, maybe you won't pass out. You've got to be there. Studies show that men are more likely to get and stay involved in the care and nurturing of their child if they're present during the birth. During pregnancy, your partner's hormones are going crazy. She's dealing with a lot of changes in her body. You might find that she's irritable at times, and you might even wonder what happened to your loving mate. Then there's the unreasonable demands. Some nights you'll be running out to the corner store to satisfy crazy cravings that she's having. It's normal. Be patient and reassure her that you still love her and you find her attractive. When it comes to the birthing experience, not many guys actually enjoy the experience, but most women don't either. In the end, you'll be closer to your baby and your partner for being there and participating in it. With the onset of labor, the pains begin. She screams and screams and screams. What should you do? It can be very confusing, and you will feel helpless. Most importantly, be supportive, which can be difficult while watching someone you love in that much pain, especially when your kind words are met with glares and profanities. If yelling at you distracts her from the pain, then at least you're helping. Research shows that when a woman has a supportive birth partner, her need for pain-killing drugs is reduced. It also increases her satisfaction with the birth experience. This also can make her more confident that she will be a great mom. See, just being there and having already made it easier on her. There are many other things you can do to help, which will be good to know when things become a little frantic, and they will. This book will help you prepare for the birthing experience. You'll learn how to help with back labor, understand what happens in the birthing room, how to ease pain, and how to deal with your own feelings of helplessness. It can be daunting and a scary experience, but you can get through it just like she can. Read on and see why men have labor pains too. Changing roles. As mentioned earlier, not so long ago, the man's place during childbirth was waiting in a smoke-filled room holding a box of cigars and a bouquet of flowers. Not anymore. What brought about this change? Books had a role in this transformation. In 1974, Robert Bradley wrote the book Husband Coach Childbirth, in which he empowered men to take a crucial role in the birthing process. At the time, Bradley was both hailed as a champion for men's rights and criticized as someone who was trying to advocate controlling women. Despite, or perhaps because of the controversy, the book gave birth to the Bradley Method, and a series of classes still run today in the USA. Putting husbands in the delivery room coincided with feminism and is ultimately wrapped up with the natural childbirth movement. People were becoming more comfortable with pregnancy, and the body was looked at in a more holistic fashion. The change could also have been brought about with cultural developments. Back in the 50s and 60s, it was an unspoken rule that men didn't go into the delivery room. However, in the 70s and 80s, men began questioning the medical status quo and took a more hands-on approach to child rearing and the rights to being present during their child's birth. The dissolution of the nuclear family also contributed to the change, with fewer women around to take care of the expectant mothers needed during childbirth. This naturally led to the man taking on that responsibility. Changing attitudes about pregnancy in general also brought more men into the delivery room. With more and more people having children without being married, as well as the rise in teen pregnancy rates, the man in the delivery room isn't always the baby's father. Today, it's expected that the father be present for the birth of his child. It is increasingly uncommon for the man not to participate and help out in the labor and delivery. Not all men embrace this, however. Some fathers, particularly first-time dads, feel apprehensive about seeing the woman they love in pain. Top concerns amongst expectant dads are embarrassing faux pas in the delivery room, fainting, feeling sick and squeamish, and basically not knowing how to best support their partner through a potentially long and painful process. There's also the possibility that your partner might not want you present throughout labor and birth because she doesn't want you to see her in childbirth. She may feel that she wants to be free to focus only on herself and her needs. You might quite like that idea of being her coach, only to find that she does not want you telling her what to do. Talking through these issues during the pregnancy can go a long way to avoiding problems once labor begins. If you yourself are unsure, talk with other guys about their experiences in the delivery room. Just keep in mind that everyone is different, and one man's experience may not be the same as yours. If she wants you there with her, that should be your biggest deciding factor. If you absolutely cannot see yourself being present for the delivery of the baby, consider a couple of alternatives. You can arrange to have another labor partner present so that it all gets to be too much. You can leave the room either for a short time or until after the baby is born. You can choose to be present just for the labor or conversely, just for the birth. You can also come in directly after the baby is born to celebrate the new life. Then there's that thing that no one wants to admit. What will it be like to see that part of your partner that is usually a source of pleasure during labor? This really can become a problem. After witnessing the physical side of birth, might some men struggle when trying to resume their previous love life? This apparently happened after Elvis Presley became a dad. It reportedly took him months to get into the swing of things again with his wife Priscilla, and shortly afterwards their love life was allegedly non-existent. Many men can be negatively affected by what they see during delivery, which makes it difficult for them after the baby arrives. The decision about whether or not to attend the birth of your child is a personal one and should be made well prior to the onset of labor pains. Men should discuss their feelings with their partner and as a couple decide the option that suits them best. Don't forget that your sole purpose at being at the birthing room is to provide strength and support for your wife. She will suffer considerable anxiety over the delivery, especially if it's her first time. She may have taken birthing classes and she may have been told what it's going to be like by a dozen different people, but until she actually experiences delivering a baby, she will be apprehensive. Support is essential, and if you won't be able to provide that, it's probably best that you have someone else in the delivery room. Some women now choose to have more than one birth partner, especially if the father might not be present. The mother should choose the person who's going to give her the support that she needs. There are many birthing options these days. Not all births take place in a hospital with a doctor. Very rarely, however, will a woman be able to deliver a baby without the help of someone. We will refer to this person throughout this book as the birth attendant, whether it's a doctor, a nurse, a midwife, or a doula. Much of the hesitation men have about being in the delivery room has more to do with the lack of preparation about what to expect and training as to what they can do to help. Let's begin by looking at the stages of labor. The baby is coming. Labor pains can come when least expected. Having a due date doesn't mean that the baby will choose that day to come into the world. The onset of labor can bring with it emotions that your partner did not expect, such as nervousness, anxiety, or fear. In fact, at this time, a mother may not even understand exactly what she's feeling. Nature has designed birth simply and elegantly. Although every labor and birth is unique, and your labor will unfold in a very special way, the process is remarkable and beautifully consistent. You have no doubt heard the line, "My water broke." This signals the onset of true labor as the sac filled with an amniotic fluid that held the baby ruptures. This can be preceded by contractions or begin the contractions. Just because a woman is having contractions doesn't necessarily indicate labor. But when the water breaks, the show's started. Many men might wonder what contractions feel like. While we probably cannot unequivocally convey this in words, we would think that being kicked in the groin repeatedly for hours while your hair is being pulled and your kidney is being punctured might come close. It's a pain that's hard to describe, but rest assured it's very intense. During the first stages of labor, the cervix softens, thins, and opens as the baby settles into the pelvis preparing for birth. The process often starts out slowly with short and frequent contractions of the uterus. Over a period of hours or even days, the contractions become stronger and come closer together. As the intensity of the contractions increase, the cervix dilates and becomes larger, and epiphysis becomes thinner, and the baby moves lower into the pelvis. The contractions are more intense as the cervix dilates and dilates for the last few centimeters. At the end of the first stage of labor, the cervix is fully open and the baby is ready to move through the birth canal. The baby can be delivered after a woman's cervix dilates to 10 centimeters. The first and longest stage of labor has 3 distinct phases: the early or latent phase, the active phase, and the transition. During the early phase of labor, contractions are often widely spaced, perhaps 10 minutes or more apart, and feel like a tightening or pulling in your back or groin. They can vary considerably in frequency and intensity. At this point, the mother may feel excited, sociable, and talkative, or a bit nervous. Most women remain at home during this phase, during which the cervix dilates from 0 to 4 centimeters. In the active phase, contractions are about 3 minutes apart, lasting 45 to 60 seconds. They become more centered in the abdomen. They also become stronger and more rhythmic, peaking and receding like waves. The woman's determination at this point may begin to wane as the reality of the impending birth presents itself. Many women think they won't be able to continue the delivery as the pain becomes stronger and stronger. This is where the birth coach becomes most important, but we'll get to that later. Transition is the time when the cervix dilates the final 2 centimeters. This is the most difficult phase of labor and produces the hardest, longest, and most frequent contractions. Fortunately, transition is relatively short, sometimes lasting for only 2 or 3 contractions. Even in the first labor, transition rarely takes longer than an hour. During transition, contractions occur every 2 or 3 minutes and last 60 to 90 seconds. There's a little relief between them, and their intensity may cause your partner to feel frightened and overwhelmed. While she may have enjoyed your presence and physical touch throughout the early part of labor, transition may suddenly make her feel withdrawn, irritable, and short-tempered. She may develop chills, become nauseous, or feel the urge to have a bowel movement. These physical sensations reflect the descent of the baby into the birth canal and can become more intense as she enters the second stage of labor. With a vaginal delivery, the second stage of labor is the actual delivery. When the widest part of the baby's head has settled into the birth canal, it's said to be engaged or positioned for the delivery. At this point, contractions may slow to 4 or 5 minutes apart and become less intense. This is when pushing begins. The birth attendant will monitor the baby's descent on a regular basis. When the baby's head is even with the lower bones of the pelvis, its position will be recorded as 0 station. As the baby's head continues to move through the birth canal, the stations will be identified as +1, +2, +3, etc., in reference to the baby's progress in centimeters. Throughout the second stage of labor, which can last from 15 minutes to more than 2 hours, your baby will continue to descend through the birth canal. As the force of the contractions are combined with the pushing, the baby is propelled through the birth channel, or the birth canal. At this point, she may become very tired, especially if labor has been long or rigorous. Most women find, however, that the second stage of labor is physically and emotionally satisfying. The contractions are often easier to tolerate, and the excitement over the baby's imminent birth usually outweighs the fatigue. As the second stage of labor progresses, the perineum area between the vagina and rectum will be stretched. The birth attendant may make a small incision or episiotomy in this region. This is to prevent the perineal skin from tearing during childbirth and provide more room for the baby to be delivered. We'll explore episiotomies in another chapter. As the baby approaches the bones and soft tissue of the pelvis, its pliable head will mold slightly to the contours of the birth canal. Once its head slips under the pelvic bone, delivery is imminent. As the baby's head appears or crowns, your birth attendant will apply subtle pressure with one hand, reaching beneath your pelvis to prepare for the baby's birth. In rare cases, forceps or vacuum extraction may be necessary to help guide the baby's head through the birth canal. At this point, it's better for her to pant rather than continue to push, so the baby's head can be delivered gently rather than bursting out. When the head is through, your birth attendant will check to ensure that the umbilical cord remains free of the baby's neck. He or she will then immediately clear the baby's mouth and nostrils of mucus, and with the next contraction, the attendant will deliver the baby's body and then clamp the cord. You might be asked if you would like to cut the cord yourself. If you don't, the birth attendant will do it. As soon as the infant's general condition has been assessed, you'll be able to cuddle and enjoy your baby. The third and final stage of birth involves delivery of the placenta. Within a few minutes of birth, rapidly diminishing uterine contractions will cause the placenta to separate from the uterine walls. Generally, the placenta is expelled rapidly. The birth attendant will examine the placenta and inspect the cervix and vagina for any tears or bruises. If you have had an episiotomy, the doctor will stitch it closed. If all is well, you and your partner will probably be oblivious to these final details as you share the joy of your new child. So there's the beauty of birth in layman's terms. Labor and delivery can go quite quickly, or it can last for hours. That's why having someone there for support is so important for the mother. It can be a very confusing and stressful time. The delivery room can be a daunting place, with the procedures mind-boggling. Now let's look at what happens when you first get to the hospital. We're here, now what? Labor and delivery can seem like a hurry-up-and-wait kind of game, and most often it is. There are things that will be done when you first arrive at the birthing facility. Most new parents have pre-registered for the stay. If labor starts unexpectedly, you may not have had time, so as the labor partner, you will probably have to register the mom-to-be. If you're already registered, just check in, kind of like you do when you're going to a hotel. They'll take you to your room, and if you're at a hospital that has birthing rooms, then you'll stay in the same room the entire time. That's why they're called birthing rooms. They make it much easier on the new parents as they aren't shuttled from here to there. Once a mom is settled into her bed, the nurse or birth attendant will check her vital signs and record them. The baby's fetal heart tones and fetal heart rate will be checked and closely monitored, as these are the best indicators of the baby's response to stress during childbirth. This is often done by strapping an ultrasound transducer over the abdomen that will pick up the sound of the baby's heartbeat. The heartbeat will be recorded continuously on a paper strip. There will be another device strapped on top of the abdomen, which is a pressure gauge that measures the frequency and power of contractions. The combination of these two measurements will provide detailed information as to how your baby is doing during the labor. If the water has broken, the baby's condition may be monitored internally with a small electrode that is actually attached to the baby's head. Don't worry, this is painless and safe. This method is performed by inserting a small spiral-shaped electrode, a fetal scalp electrode or FSE, into the vagina and attaching it to the baby's scalp to record the fetal heart rate. Usually, a small catheter is placed in the uterus to measure the strength of the contractions. Intrauterine pressure catheter, or IUPC. This type of monitor may give a more concise reading of the baby's heart rate and your contractions compared to the external monitoring. Most women will also be given an IV. This is mostly done as a preventative measure in the event that medications must be administered. The birth attendant will also do an internal examination to determine how far along the cervix is dilated. This is done very simply by inserting a lubricated rubber gloved hand into the vagina. Early on, this is done very discreetly, usually below a sheet or blanket. The birth attendant will probably also explain what is happening and what to expect throughout the labor process. They should ask you if you have any questions to answer for your peace of mind. The attendant will take some general medical information. You and your partner should be very honest about any previous medical conditions, as well as any other pregnancies she may have had. Unless there's concern about the complications or risk of infection, the vaginal examination is done to check the baby's position, the dimensions of your pelvis, and the effacement and dilation of your cervix. A blood sample may be taken and a urine specimen may be tested for protein. You should challenge any hospital procedures that seem medically unnecessary, such as extensive shaving of your pubic area or administration of an enema. There is very rarely a need for these outdated rituals. After all this is done, the waiting begins. Today, most rooms come with a television set. As tempting as it may be to turn on the hockey game, don't. Now's the time to stay focused on her. If she wants a distraction, then put it on the channel of her choice. Your role in the delivery room. There are many things you can do to help with labor and delivery. We'll address comfort measures in the next chapter. Let's first examine what makes a great birthing partner. First and foremost, it's the ultimate show of support to attend childbirth classes prior to the delivery. This can give you a much better idea of how you can help your partner with the various stages of labor. During these classes, you'll probably be given a tour of the birthing room and the hospital so you can familiarize yourself with the surroundings. Reading this book shows you your commitment as well. Explore the process of giving birth further by finding a video and watching it and talking with others about their experiences in the delivery room. Have a car gassed up at all times and mechanically ready for the ride to the hospital. When labor begins, mom may not be concentrating on much of anything else other than the impending birth. Keep track of her suitcase and make sure it gets into the car with you. Be sure to call the doctor and then call relatives to let them know the baby's on its way. Prepare yourself to be screamed at, possibly hit, and being called names that you might never have heard of. Happily, accept your punishment and don't take it personally. She's just trying to displace her pain. Remember, too, that there will be highs, lows, mood swings, and changes in behavior that can occur at lightning-fast speeds. Try to keep up. Give her lots and lots of encouragement. Tell her how wonderfully she's been doing during the process. You can't say this too often. Often women will feel there's no way they can make it through the birth. It's at this point when you need to be especially encouraging and supportive. Keep her informed. Don't chatter, but let her know how long the contractions are lasting and how long she's likely has to relax before the next one. Some moms find that humor works well in the delivery room, but to others, it may be frustrating. You need to gauge what works and what doesn't. Be sensitive to her needs. Know what your partner wants before labor begins. She might not be able to communicate her wishes, so if you do it for her, she'll appreciate it. Perhaps not at that particular time, but certainly later on when it's all over. Ask questions and get answers if you're unsure what might be happening. If she gets tired, she'll probably get very argumentative. Let this slide right down your back and don't fight it. She doesn't really mean it. When she feels out of control, this might be the only way that she can regain it. She'll do this to you because you make her feel safe. Take it in stride. Don't forget to take time out for yourself. Being a labor partner can be very stressful. Take a short walk. Get a cup of coffee. Just get out from time to time and recharge your batteries. Don't, however, do this during the end stages of labor. This could cause more problems than you'll be prepared to deal with. It would be good, too, to have a stand-in ready when you need to take a break. Do not leave her alone for too long. You're there for her support. Be flexible when offering to support and comfort. Labor strategies that work for some women may not work for your partner. A labor coach's job is to discern what works and be prepared to drop what doesn't. Well before your baby's due date, you and your partner should take time to discuss her expectations and options. Later, you can take the initiative while keeping her wishes in mind. Help her through transition and pushing. When contractions are doubling up and she's using every way you can think of to breathe through them, and she's been busy breathing to say anything, you can honestly tell her that it will be soon. When your partner feels the urge to push, stay close. Look in her eyes, speak calmly, breathe with her, and look happy. She's going to be in a lot of pain, so you need to be prepared to make decisions. Only you and your partner know what you both want, but she may not be in the best condition to make hard decisions. Be ready to step in with some decisive action if the situation calls for it. There's a lot going on in the birth room. Be aware of what you are willing to do during the process and what you want to leave to the professionals. Though there will be lots of experienced people around with whom you can look to for help. Even though they will help, Keep in mind that this is a regular occurrence to them, and because of that, they won't be as sensitive to your partner's feelings. You will be her most important support. This is one of those events when just showing up is the most important thing of all. Even if you want or have to leave most of the hands-off stuff to the pros, what matters is that you're there. Some expectant dads say they're worried they won't be able to be up to the task, but skipping out on labor and delivery isn't an option these days. Realize that labor is not only physical, but extremely emotional. There may be moments she may not know what she wants. Just being there, respecting her, offering suggestions to change positions or different techniques to manage discomfort, or simply embracing her and telling her she's doing great really helps. She's also going to remember this experience the rest of her life. You want to be a positive part of those memories. Childbirth is one of life's mysteries. Worrying is part of it. It's normal and expected. Your baby's birthday will unfold in its own way and have its own story. Take a deep breath. It will all come together. Trust yourself. Just be you, and above all, just be there.